So welcome everybody to this webinar. My name's Helen Ward. I'm a Professor of Public Health and one of the co-leads for this Masters of Public Health programme, which we deliver online in partnership with Coursera. So it's great that you've shown interest, and I hope that we can give you a bit of a flavour of the course and answer questions, and you'll hear from some students who experienced the course already. So I think we'll introduce people as we go along. There's myself, Helen Ward, and Paul Aylin, who is the co-director with me, will be doing the first bit. And then Anna, who is showing the slides and everything, will come talk to you with Patson and others about some of the practical issues. So let's get, well, we had to show you this, that we're second in the world and first in Europe and the UK in terms of our ranking as a university in the most recent QS rankings. And so we're very proud and we're very pleased that you're interested in joining us at this extremely good, extremely enjoyable institution. And yeah, so let's get on to this. What we're going to do this afternoon, or whatever time of day it is for you, start off with our welcome, then a brief overview of the programme. We assume that you have actually looked at some of the details online and had things sent to you, but we will just do an overview of the programme in terms of the why you would want to do it, and what the broad content and who teaches on it, then a bit about the structure and the alternative routes that you can take in terms of this master's level training. And then we will hear from some former students, Doug and Madeline, about what they think, and they're free to say whatever they like. We haven't, as far as I know, we haven't paid them to say what we want. Then there'll be some more practical issues around the overview of admissions, what you should do, how to prepare your statement, etc. So let's get going. Next slide, please. So why would you do a Global Master of Public Health? So this is a fully online degree. I think the main reason is you're obviously interested in public health, which is very, very important, and it is a huge priority in terms of the world, all countries all over the world, inequalities in health and preventable diseases that are not being prevented, and people who are suffering who don't need to suffer. So we're all dedicated to improving public health. And the team that has developed this course and that is involved directly in teaching on this course, many of us at the School of Public Health at Imperial are centrally involved in shaping public health policy in our own country and countries, but also at a global level. Many of the people that, if you join the course, many of the people who will teach you and who you will hear from work closely with the World Health Organization, with other global institutions that work on vaccine delivery or on AIDS control or non-communicable disease control. And you'll find that we teach you in relation to the basics, but also what's currently going on. What are the key issues in global health, global public health at the moment? What are the challenges? And what you as a developing public health professional need to know in terms of how to translate the science that you will learn into policy and impact. So our teaching team have lots of different backgrounds, because public health is not a single discipline. We have people with medical, nursing and allied health backgrounds. We have people with maths and economics and modelling backgrounds. Also those who work in environmental health, engineering, and many, many others. We make sure that the material, although it is a lot of the material is online and there are videos that have been recorded in the past, we revise and update the curriculum to make sure that you've got most up-to-date information. And we've designed this, I say we, it's Paul and I actually designed this a few years ago with the very specific target audience of people who probably had other jobs and other responsibilities, so would be doing this part-time and have to do it flexibly and fit it in around the rest of their lives. You have advice from academics on what program pathways to take, how to select the different, we call them specializations or modules, how to select those to get the best out of it for what you want to do. And then there's a lot of student support. So, Paul.
Well, I was just going to say it's probably important to say that this whole course was designed from the ground up, building on a lot of the experience we have from our very popular on-campus courses, but it was designed from the ground up to be an online course. So it is completely designed around that. New materials. We've taken advantage of all the potential sort of teaching approaches that an online platform offers us. So it's a very modern course, but builds on. I don't want to say how many combined years Helen, herself, and the rest of the team adds up to, but built on a lot of experience of both research, but also on teaching, both on campus and online.
So I think, Anna, the next slide I think actually is around the delivery. So Paul, perhaps you would like to carry on with what you were just saying about.
I will. So we've taken. Yeah, so we've taken advantage of the of everything that the online platform offers us. So we've got away from sort of 1 hour or 2 hour lectures, and everything is designed towards online delivery. So we have short, succinct videos. There's obviously a lot of reading and reading material offered. We've got e-activities, we've got quizzes, we've got sort of workbooks that allow you to go through and analyze data using a standard statistical package R. And essentially these components allow you to do the course to a certain extent in your own time. There are deadlines around exams, and we work on a sort of semester or term basis. So, but within that semester and within the deadlines for assessments, you can essentially work through this material in your own time, whether you want to do it in evenings or your days off or weekends. We also offer some live content. We have live sessions with the teaching teams in each of the modules, and they're held on a regular basis, and we try and stagger the times so that people from different countries have an opportunity to attend, and they're all recorded as well. So if you miss those, you're able to catch up on those records, and they will often take the form of some group activities, or we might invite guest speakers or previous alumni from the course to talk about their experience in going through the course. Particularly, I'm thinking of our research portfolio course, where students will talk about their research projects conducted through the through that module. We also offer office hours so that people can ask specific questions to the teaching team. And as I said, we tend to alternate the times of these sessions so that everyone gets an opportunity to attend wherever you are in the world. It's important to stress this is a fair bit of work, this course. So this is a master's course at Imperial, so you would expect it to be hard. And indeed, it is hard, but we hope hugely enjoyable as well. We would expect that if you're doing, well, and we'll explain a little bit more about the pathways in a minute, but if you're doing the 2-year course, you might expect to have to spend around 20 hours a week studying. So that's both sort of looking at the videos and the content and things like that, but also taking part in the assessments and preparing for assessments. And if you're doing a 3-year course, then that's obviously a little bit less and a little bit more spread out. So, shall I go through the pathways? This is the pathway.
Yeah, do you want to do that, and then I'll hand back to me if you want?
Yeah, so you've got an option of either doing the 2-year master's course or doing a 3-year master's course. It's the same content, but the 3-year course is obviously spread out a little bit. If you don't feel ready to go to lunge straight into the master's course, we do offer a couple of other options. Firstly is our postgraduate certificate. So that you can do in a year. You can then, and that's an accredited certificate from Imperial, and that covers very much the sort of core modules that we offer within the degree. You can then choose to go on and do a diploma, where you'd go on to study for another year, and you get the opportunity to do some of the options that are offered to people doing the full degree. And you then have the option, if you've done the certificate and the diploma and then feel that you want to go on and do the masters, you can then go on and do that. And that's really that year 3, if you've already done the certificate and the diploma, is mainly the sort of research component of the masters, as well as 1 or 2 optional courses. So you can either leap straight into the master's course, either do it over 2 years or 3 years, or you can choose to do a certificate. And if you like the certificate, you can do the diploma. And if you like the diploma and feel that you want to go on to do the full degree, you can do a 3rd year and get your full degree.
Can I ask you to talk about how the research portfolio is structured, because it's quite different from any other master's programs?
You know, I'd be delighted to talk about the research portfolio because that's I think one of the challenges that we've met quite well in delivering an online course. So most master's courses, a requirement is to do a substantial piece of original research, and our online course is no different from that. But the challenge was how do we deliver that online? So what we've done is divided a research project up into modules, and we start in term 3, if you're doing the 2-year pathway, with generating a research question. So this module is all about developing a feasible and clear and focused research question. And we help you through developing a research question. Even if you've got no idea when you start, you certainly have an idea by the end of this module. And we also take you through how you might find gaps in the research and how you might justify that research question with some work around how you do a literature review and systematic review. Once you've got your research question, you then go on to the second part of the research portfolio, which is the first term in year 2 if you're doing a 2-year pathway. And there we will take you through how you design a protocol, how you actually go about answering the research question that you've decided. And by the end of that, you end up with a research protocol. And that's in fact the assessment, a research protocol. And then the 3rd module, Research Portfolio 3, takes you through some core research skills. So that is around making an ethics committee application, making an application for funds, and also engaging patients and public in your research. So there are 3 separate modules there, and you can choose to be assessed on 2 out of those 3. All of them really essential core research skills for when you go out into the wide world and carry out public health research. And then the final term of year 2 or semester is around actually carrying out that research. So you've got a research question, you've designed your research protocol, you will have been through ethics if that's required, and then you can spend this whole time on actually carrying out your research and writing it up. And the assessment is designed to be quite authentic in terms of we ask that you write up your research in the form of a journal paper, a scientific paper, and you submit that. I think it's 3,500 words or so. That actually puts you on a very good course. If you want to then go on and publish your research, you already have a fairly well-formed manuscript to work on and submit to an academic journal. So that's the research portfolio. It's often daunting to students when they first start, but actually we've had some remarkable research projects come through this portfolio, and some really good publications come out of it. So I think, well, I would say that it's a great module, or a great series of modules to do. But I think it's one of our USPs, how we take our students by the hand and lead them through the whole research process.
Thanks, Paul.
Would you like to talk more about the core and compulsory modules? Why you, when designing the program, you decided on foundations, EPI, health system development, or health protection?
I can talk about that if you like.
Oh,
yeah.
Whatever you want to like.
So I think so we have some core modules which we think anyone graduating with a Masters of Public Health from Imperial College should have. And these include foundations of public health practice, epidemiology for public health, and some basic statistical skills. You can see from the slide here how the 2-year pathway is laid out. Some of these are compulsory, but in each term you do have a pick of some other modules to do, and in the 2-year pathway you generally do 3 modules a term, and if you're doing a 3-year pathway you'll do 2 modules essentially per term. So you can see the core modules in green, and then we've got some other modules which you have options of when to do them, and then you've got a number of elective modules or choices around global health innovations. We've got an excellent module on infectious disease modelling. We're developing modules all the time, and a relatively new addition to our courses, machine learning and how you apply that in public health. We have a digital health module. So a whole range of different modules that you can pick and choose from to build the kind of masters public health that you desire.
Yeah, can I just say that there, with those options, what you can do is you can choose, obviously you can choose pretty much whichever you like to combine together, but you could decide that you're particularly interested in the data science side of things, and therefore you would, in addition to the statistics of public health, which everybody does, you might choose the infectious disease modelling, which is very obviously very quantitative, and it's based on developing models to predict and understand infectious disease transmission. You may want to also do the machine learning. the advanced statistics and introduction to data science, so that you'd then be able to say, right, I've got a master's in public health, but I've got a real focus on those skills and the application of that to quantitative public health, whereas someone else may be more interested in specific public health programs, perhaps at a local applied level, where you'd be looking at quality improvement in healthcare, or you'd looking at the use of digital health in health improvement. We have a course on participatory approaches in public health, which is about how you work with communities, community engagement and involvement to try and ensure, one, that you address inequalities, but also that you make sure that you take communities with you and you work with them to improve health as effectively and acceptably as possible. So you can, it is very unusual when we have compared our course to other Masters of Public Health, particularly online courses. We have a very, very large number of optional modules, which we think helps you to choose where you want to go with this. So just the next slide, Anna, just shows what you're doing if you're doing the certificate entry. It's not, if you do all 3 years of that, you don't get a certificate and a diploma and a master's. If you've completed the certificate and then enroll on the diploma, you would leave with a diploma. And if you then go on to the Masters of Public Health, you leave with the Masters of Public Health. You don't. But we've introduced that because there are some people who don't want to do the research program, or only want to do the core, the absolute essentials. But they are really important essentials that people who maybe not want a career in public health, but want to use public health skills in their clinical work or in their other roles in government or policy or whatever. So we've tried to be as flexible as possible. So I think now time to hear from students, I think, who will tell you what it's really like. I think we tell you what it's like in theory. So I don't know who's going to go first, Doug or Madeline, but if you want to introduce yourselves.
Sure. My name's Doug Northcott. I took the 2-year program, and originally I was a data analyst working for a hospital in Southern California. And I graduated back in, was it last year? And I now work for the state of Utah Department of Health and Human Services as a senior epidemiologist for the tobacco program.
Hello, my name is Dr. Madalin Margan. I am now an assistant professor at Timișoara University in the public health department, and soon I'll be the medical director of the municipal hospital here in Timișoara, that is a city of 500,000 people. So I graduated in 2023. I took the 2 years program, and I believe the masters at Imperial skyrocketed my career when it comes to the great skills I got when it comes to statistics and data science, and also when it comes to the great reputation that that Imperial has nowadays, being the second university in the world, and this reputation is spreading in the academic field. And yes, when my CV is now well received in different environments, the public health environment and also the governmental environment. So yeah, I can detail more on this subject if you want.
So I wanted to ask both of you really. I mean, obviously you're both of you, you're advancing your careers, and that sounds great. And I just wondered why you chose this particular degree. Doug, do you want to start?
Absolutely, yeah. As I already said, I was junior mid-level data analyst for a hospital in the finance and administration division. And I was just looking through the program, and the fact that the program has a lot of data analytics, statistics, and R programming. And I knew that in the industry, that certainly in the USA, that's the way everything is going. That suited me down to the ground, and I researched the 2-year format. And although it was a lot of work when it was going on, it was easily doable, and there was plenty of support going around. And so I was able to work this while keeping my job going through, actually ended up going through COVID. And halfway through the program, I saw this job online, and I actually took my IDM, the disease modeling, and just thought, why not send it in with my resume? And I actually got the job that I have now because of it, and the state of Utah loved it. And so it was because of the detail and level of the work that and the courses that you provided is the why I chose this program. Does that make sense?
So just to before going on to ask Madeline the same question, what are you still using those skills?
Yes. Yeah, I'm
not
actually
just a COVID thing.
Oh, no. I'm actually teaching some of the epidemiologists through a program that we set up internal now. I'm teaching them infectious disease modeling.
That's the best way to really learn, is to try and teach other people, isn't it?
Yeah.
Great. Well, that's great to hear. So Madeline, what about you? Why did you pick Imperial on this particular course?
Yes, first of all, it made sense to be online because I was already working. I wasn't aware at the beginning how technical it would be. So I thought it would be the non-technical part would be more important or more frequent, more important. But then as my colleague said, that let's say after a few months, I realized that this will be very technical. But the skills that I got from R programming, from the data science module, I'm still using them nowadays. It transformed me into a statistician, actually, or a clinical data scientist, let's say. And I'm also educating my students now with these skills. So I'm also teaching these skills. So I'm not saying like everything I learned happened during the masters, but the masters provided me the first bricks or the first layers, which now I'm building on. So it introduced me to R, introduced me to the data science field. I was very skeptical at the beginning, but then I started to like it. And then after the master finished, I worked more and more, and now I can say I'm a professional. Let's say I'm a clinical data scientist, and I'm really proud. I'm the statistician to go in my department. So I advanced my skills, and yeah, I'm also teaching statistics. So because statistics is also part of the public health curricula here in Romania. So yeah, it really helped me. It launched my statistics and data science career, let's say.
Madeline, you were running hospital when you joined us, is that correct?
Yeah.
So you come from a medical field, and now you go towards more statistics and teaching. Yeah. So immediately after 2022, I think or 2023, I stopped the managing of the hospital because the politicians changed, and I was interimary, actually, interim. Right. And then I went back to the university, and now I'm a full assistant professor, and now I will probably go back to the hospital, to another one, a bigger one. So, yeah.
It was a very challenging period during the masters because of the pandemic, because I also had some personal issues. I had a car accident, I had COVID 2 times, but the staff was very friendly, very supporting, and I think that was an important aspect also that I want to mention. Even though it was challenging, the staff support was great. So, and also the professor support was great. The answer to all my questions and all my administrative problems that I had. So it was great experience also with the support I got.
Thank you. That's great to hear. So lastly, I think any advice to students considering this program, what they should look for if on this or other programs? There are other programs available.
I think for me, it's been a really great program. Advice, just dive in, get going. I mean, it's everything you would expect from a top level program. Even when looking at that, it's in the same way that it demands are there, but it also provided me with background. I mean, for example, this last year, I was able to, using the skills I learned in the research portfolio, I was able to use that, and the state of Utah has now been the first state in the USA to introduce a nicotine percentage limit on vapes, for example. And it was that skills that that I learned there, what just made it great for me and allowed me to do my job that I'm doing now. I'm just trying to think of more advice. I think it's the reason why, going back to the reason why I chose this program over others, is just because of the reputation of Imperial and the choice of courses. When choosing courses, pick them to what you think you'll be able to use in the future. I think that's about it.
No, that's great. Anything to add, Madeline?
Yeah, that's a great example to choose what you would probably use in the future. At first, I was not aware, as I said, about the importance of data science, but I realized it during the module that it would be, or before the data science module, I realized during the statistics module that would be, that I should go more technically, even though I was circumspect about it. And another important thing I'll add is not be afraid of diversity when it comes to what the courses you choose, the modules you choose into elective modules, because the skills you can get should be as diverse as possible, because it will help you in your career at some point, because public health is a very diverse on its own. It's very heterogeneous, let's say. You can do, my example, I can do statistics, but I can also do a protocol or health assessment project. So it's, you want the moment when you specialize, it comes long after the beginning of career. I don't think you get very specialized at the beginning, like it happens in internal medicine, for example. You specialize very early on some subdomain like echocardiography or in surgery. You specialize on some plastic surgery, and you do just that. Here in public health, you have to be more powerful with your skills or more competent in many domains. I don't know if this is the fact in other countries, but here in Romania, you have to do a lot of diverse things. And this is why Imperial was important for me, because it teach me intros for every domain. I mean, I am knowledgeable on every domain of public health. Not in depth knowledgeable, but I have the ideas on everything, on every subdomain. I have that intro, how should I say, base knowledge in every public health domain. And I think that's also important.
Well, thank you. I mean, it's great to hear, and it's particularly encouraging, well, hopefully for Paul as well as myself. When we set this up, our intention was to increase public health education access globally, which is, that's a bit of sounds a bit pretentious, doesn't it? But we wanted to make it our training available to people worldwide, but also to hear that you both are now also teaching others is really rewarding to hear that, because that whole kind of building that up is fantastic to hear, as well as what you've done with your own careers. You're going to help other people do the same. So thanks, that's really helpful to me anyway, hopefully also to the prospective students on the webinar. So anything to add, Paul, before we hand over to Anna?
No, I agree. And actually, it's only a fora like these where we get to hear our alumni feeding back that it's really good to hear. It's also good to hear. I mean, we have, although of course there is theory in public health, there's a foundation of theory. We have tried to make it very practical and useful and applied. And particularly in our assessments, one of our ambitions was to make our assessments sort of fairly authentic, so not sort of essay type assessments, but to give you assessments that reflect what you might be doing, going beyond the degree in your own careers, and it's good to hear that that's helped. In terms of Doug's and Madeline's career going forward. So, well, thanks both of you for coming to this this webinar and giving us your experience. Thank you.
So, Anna, over to you.
I think Patson will start, and then I will talk more about the personal statement.
Yep, thank you. So this first slide here is a general overview of the admissions progression funnel. You would first need to make an application on the Imperial College website. Once you make an application, it'll get forwarded to the admissions department, and in the School of Public Health department, we have reviewers that will review through it. And a decision will probably be made around 4 to 6 weeks. Once a decision is made, you can accept your offer within 21 days. And once an offer is accepted, you'll be forwarded to the onboarding course. And the courses usually start in September. So what are the minimum entry requirements? You need to have an undergrad degree with the 2.1 in any subject area or an MBBS degree. Having a science background is not mandatory because we take applicants from all different backgrounds that have a passion for public health. We accept a wide range of qualifications. I can share that link for you in the chat so you can look at what qualifications are accepted from different parts of the world. That link is right here. So when making an application, you are required to submit your transcripts. If they're not in English, you need to have them translated to English. You need to have a personal statement, and Anna will run you through how to write a personal statement a bit later. You need to have a CV and 2 acceptable references. So you need to provide contact details for any academic or professional referee, and personal emails cannot be used. If you do use a personal email, then make sure that the referee has an official letterhead attached. So the college also does not allow for dual enrollment. You cannot be enrolled for more than one award at the same time. This also includes awards that are at Imperial or any other institutions in the UK, basically. Next slide, Anna. Yeah, Anna, could you run through what the reviewers are looking for?
Sure. So Patton will in a minute also mention what level of English we are looking for. With regards to personal statement, it's got a few very important bits to include. So the first thing is why us, why Global Health, Public Health, why Imperial, and obviously then why you are looking for a career in public health. So that would be a clear account of your interests and goals and what have you done, maybe in the field, maybe in the similar field, what kind of research experience you have, professional experience, because you might have been out of education for quite some time, and we have applicants who are 30, 40, 50 years old. So they come back to either change career or develop more into public health and get additional qualifications. So the reviewers will look on all those things while making decisions. So this is a run through what should be included in that personal statement. If it would be very useful to include whether you have any kind of statistical experience, research experience, either from university or from work, and obviously what draws you, whether you have any special interest in public health that compels you to apply for the degree with us. So basically, why us? Why are you interested, and how does your professional and educational background align with what you want to do in the future? And this is now how you meet the offer conditions. As Patson will mention in a minute, there are certain conditions that you meet apart from the academic conditions, like the 2.1. But please note when making an application that you have all the documents in order, because we can't start reviewing applications if, let's say, references are missing or CV is missing. So when you submit, just make sure that everything is there. Patson, would you like to talk about the conditions?
Yeah, thanks, Anna. So if you are made an offer on the program, when you log into the admission system, you see that the status on your application is condition pending. And then you'll have 21 days, as mentioned before, to accept your offer. Once you accept your offer, your status will then change to condition firm, and the offer conditions will be laid out to you by our admissions team on the system. So the offer conditions can be three things. It can be the English language test if required, because some applicants sometimes are exempt from doing an English test, and our admissions team can let you know if you have to take one or not. You'd have to provide your academic conditions, which will be verifying your degree and transcripts. And finally, the payment of a 10% deposit, which will be invoiced to you by our tuition fees department. So once you meet all of those three conditions, your status will then change to unconditional firm on the system, and that will mean you're ready to enroll onto the program. So there's links on that slide, and we will forward these slides to you after the webinar is concluded, so you can have a brief look at them on the website. So as part of the English language test, you need to meet the higher standard level for the postgrad programs. So you see the screenshot examples for IELTS. The higher level is a 7.0 overall, with a minimum of 6.5 in all elements. And for the TOEFL, if you choose that test, you need 100 overall with a minimum of 22 in all elements. We also provide other English tests or accept other English tests, and the link again will be shared to you a bit later. So the admissions closure date is the 8th of July. We would strongly advise that you make an application before that deadline, so that we have enough time to review them and provide you a decision. And then finally, if you have any other questions related to admissions or the program in general, you can contact us at that email, gmph-queries@imperial.ac.uk, and one of our program support team members will get back to you. And finally, here are some useful links. Again, like I mentioned, these will be shared to you, and I'll also drop in some links in the chat box for you so you can bookmark them right now. I guess we can move on to answering questions.
Yep.
Thank you.
So there's questions, I believe, in the Q&A box.
Yeah, there's a few in the Q&A box that are marked. Let me bring up the first one.
I can field the question. So
Sure,
the question is about the research project. So does Imperial provide a research supervisor, or are students responsible for finding their own supervisors in their own countries if they're completing the project there?
So I can answer that one because this is my my field. What we offer is a research group of students with an academic or a teaching lead with a specialist knowledge in either that topic or the research approach. I think our philosophy is very much to help students learn off each other. So there's much to be learned by discussing your own approaches to researchers, but we offer regular meetings with our research groups to give students support during the project. Of course, that doesn't stop you from speaking to other colleagues in your own country about the research that you want to do, and quite often people will pick a research question that perhaps might be within their own work domain, and we'll get some support from that. But the approach is not to provide an individual research supervisor. We find it's much more effective to have a group of students working together and led by our research group. I can't remember what we call them now. RPGs? No, that's
support group, project support group. Sorry, project support group.
PSGs. That's right.
Yeah. Okay, and it's another question regarding the research. So somebody's interested in systematic review or meta-analysis.
Yeah.
And how can students get resources to do that, and how students are supported to run their own, prepare the final project?
Okay, another one, I suppose, for me. We have in the first part or research portfolio 1, refining your research question, there is some material from the library over, I think it's delivered over 3 weeks or so, which tells you how to go about doing literature searches and systematic searches and reviews. You can then choose, once you've come up with your research question, you can choose to answer your research question in a variety of ways, and many of our students do choose a systematic review and sometimes a meta-analysis combined with that as their project. So that's perfectly acceptable. You'll develop a research protocol in the second term and define your research terms and where you're going to, which resources you're going to use. And then there are also optional workshops during that last term around all sorts of topics. And one of those is around how to do a meta-analysis. So there is a lot of support, and we do have a number of students who choose to go down the systematic review route. So there's also lots of support amongst fellow students in doing systematic reviews. So that is very well supported, and we welcome people who are keen to do that as a research project.
And then the question I keep getting asked every single admissions webinar: what about accreditation? What does it mean that we are not accredited, like the US universities are accredited? Does it mean that we're not recognized in Europe if we're not accredited?
A good question. It is a very good question. So there are, as you say in the US, there are certain accreditation schemes that say this is an accredited public health master's course that is accepted if you're going to apply for a particular type of job in public, usually in state or federal level public health. There are some similar accreditation schemes in some European countries, but we decided not to go for specific accreditation. We didn't want to limit. There isn't an accreditation scheme in England, the UK, and we didn't want to limit ourselves to one particular group. What we're teaching and what we're proud of is we're teaching the science and the application of public health in particular areas. And in fact, when we've compared our competencies and skills that students develop, then they actually meet most of the accreditation schemes if you were to go that. And actually, as the former students and alumni have mentioned, the reputation of Imperial does a lot to help smooth that out. So I think, Doug, maybe you want to add to that.
Yeah, from a personal perspective, actually living and working in the USA, this hasn't been a problem whatsoever. As you said, Helen, the reputation of Imperial far exceeds the accreditation. And for me, my career is going from strength to strength. So I wouldn't ever see that being an issue for anyone.
Thank you. I mean, so in some countries, like in the UK, there are particular exams or fellowships that you apply to, and you have to take their own entrance requirements anyway. So that's why we've taken that decision. I just wanted to respond to another question. It says, how do we ensure that students interact in an online course because other Coursera courses lack that? So yeah, we've worked as hard as we can to make that happen. So Paul mentioned we have live sessions, which is where one or two of the faculty and teaching staff will be there doing like teaching sessions, but they are themselves very interactive and often have group work for students who attend. We'll go into small groups and we'll work on a question, or we'll have read a paper and we'll do a critique of the paper and then present it back to the wider group. In a lot of the modules, parts of the assessment will involve group work where people will be put into groups and will work together on either a presentation or divide up tasks, so that, because that is actually one of the skills of public health, is learning how to work in teams. And we also, there are a number of communication channels that are set up. I'm not sure what are you still using Snap? I don't know what you're using these days. But probably everybody's using WhatsApp. But anyway, there are formal and informal channels. So my understanding is that if students want to have a lot of engagement, they will do that. Some students, of course, do it very much in their own time and are not so engaged. But yeah, that's my understanding. But I don't know if anyone wants to add to that.
We've already mentioned the project support groups as well, where students come together and work on their projects.
There's another question that, will the online program be taught differently than the on-site program? Good question. It is actually very different, I would say, because the on-site program is traditional, not in a bad way, but it is a traditional program where a lot of the teaching is lecture or seminar based, in person, sitting in rooms with a longish presentation at the beginning, and then working in either smaller groups, tutorial groups, and so on. In fact, since we've developed all the online material, now the on-campus program uses quite a lot of that as either backup or parts of their teaching delivery. I mean, we all teach on both. It's not as if there's one team teaches online and one team teaches in person. So there's overlap, a lot of overlap in the content, but the form of delivery is what you'd expect for an on-campus program. And there's a lot of face-to-face. There's a high level of face-to-face. It's taught full time. We do find that the audience, the students, are different. They're quite different. That most of the students in the on-campus program, well, they're there full-time, so they're not working full-time. They have to be in London. They tend to be younger and less established in their careers, or even straight out of undergraduate or early medical training programs. Whereas on the online program, you get, as Anna has said, people from a much broader range, people who are quite advanced. That sounds a bit rude, really, but older, who might have spent 15, 20 years in one career and want to change, or they are established healthcare professionals who are running hospitals or who are, quite developed in their careers, but want to then get training in public health so they can make more difference in their careers. So we get this very big range, and we do get some people who are, are closer to the on-campus recruits. So can we switch from a 2 to a 3 year program? You can, yes. Many people do. Not many, but some people do, because they find that they can't quite keep up, or their work changes, or they have a baby, or something else happens in their lives, and they need a little bit more time to complete it. So yeah, we are flexible for that. There was a program earlier on. There was a question earlier on about, I think, by starting on, yeah, you can start on the you can start by, if you wanted to do the diploma, or whichever you registered for, the certificate, diploma, whatever, and turn it into the MPH. Anything else that's come up? I know that there's been quite a lot of questions answered in the chat. Have you noticed anything else?
There was nothing for now. I guess it was mainly around, I think there was one question earlier about different backgrounds. I'm not sure if we answered that yet. And if it's okay for applicants from different backgrounds apart from public
Absolutely.
health to apply.
Yeah. If
Yeah.
everyone the program, with people who already have PhDs, so probably from every possible background, maybe not autistic, but yeah, economics, pharmacists, doctors, I would say, yeah, data analysts, people who teach, nurses, and anyone who wants to develop more in public health area.
We've had civil servants, we've had ministers, I think.
We still have a minister, yeah. We still have a minister.
Yeah.
So I think although we probably don't get many artists who focus solely on art, we do get social scientists. We do check, and Anna mentioned it in terms of the our sort of criteria for recruitment. If you haven't done any maths or stats since you were in, I don't know what people you'd call it, kindergarten, or first grade or something, you're going to struggle. You need to know that there is a quantitative element to this. And so if you haven't done anything since you were in early secondary school with maths, then we think you would struggle. It is possible.
Suggest that one of the ways to find out is to do one of the MOOCs that are available on Coursera. Alex Bottle runs a very good statistics in public health MOOC, which is a distillate of some of the material that we use for the degree. So you may want to have a go at that and see how you get on, which will give you some idea of the sort of numeracy required.
Yeah. Okay. So I think if there's no other questions coming up, then I think we can probably draw this to a close. Anna, Patson, any last points in terms of what happens next?
Yeah, so everyone that registered for this webinar will get the slides and the recording of this webinar in a few days' time. So you can go through it, and you can contact GMPH Queries at Imperial for any further questions as well. And yeah, that's it from me.
Great, and nice to see so many participants. 80 of you out there. That's fabulous. And I suppose we should definitely thank Doug and Madeline for their contribution and their honest appraisal of the degree. Thank you so much for sparing time.
Yeah, thanks everybody, and yeah, have a good rest of your day, whether it's morning, afternoon, or hopefully it's not middle of the night to too many people. But right, okay.
All
Thank
right.
you.
Thanks everyone.
Cheers.
Bye.